Hello, my name is Juliet Simone, and I am National Health and Program Director at Oasis, a nonprofit based here in St. Louis. Our mission is threefold. One, to provide quality lifelong learning programs for older adults. Two, ensure that older adults have access to purposeful volunteer opportunities to stay engaged in their community. And three, to make sure that older adults have access to health and wellness programs, not only here in St. Louis, but in the 8 cities in which Oasis centers are also located. However, today I'm here to talk about community-based solutions to an ever-growing health problem, diabetes. So we all know that the prevalence of diabetes is really high and that it's been growing over the last several decades. Missouri, however, has a higher percentage of people with diabetes than the national average by about 1.5%. And for the most part, diabetes prevalence increases with age, but also African Americans have a significantly higher prevalence of diabetes than do their white counterparts. People with low income, less education, and those who are uninsured also are more likely to have diabetes. And diabetes that isn't well managed can have many negative health outcomes, including, or not only for the person living with diabetes, but also negative outcomes for their family and also for the healthcare system. Diabetes accounts for many emergency room visits, hospitalizations, disabilities, and even death. However, there is a lot of good work being done here in St. Louis to help reduce these negative health outcomes of diabetes. Community-based organizations like Oasis and other community hospitals are working together to address this problem from a community-wide perspective. And it's my job to make sure that we reach as many older adults in the St. Louis metro area as possible with high-quality, evidence-based diabetes self-management programs. One such program is called Better Choices, Better Health Diabetes. And this program is incredibly powerful for 2 main reasons. One, research shows it's effective to help manage diabetes better. It reduces people's A1C even a year after taking the workshop and helps people gain the self-confidence it takes to better manage their diabetes on a day-to-day basis. And that includes things like making healthier food choices, figuring out the reasons why it's so important to monitor blood sugar, and to also create and maintain physical activity programs. The second main reason Better Choices, Better Health Diabetes is so incredibly powerful is the method in which it's delivered. Oasis recruits older adult lay leaders to be trained to teach this program in the communities in which they live. So this level of a small group setting creates some comfort and rapport among the participants with the facilitators Oasis trains. And that level of comfort, again, increases that confidence for these participants that they can better manage their diabetes too. Unfortunately, only 2% of Medicare beneficiaries are using their allotted diabetes education benefit every year. The number one cited reason by healthcare providers for this underutilized benefit through Medicare is because they don't know where to refer their patients into the community for this high-quality diabetes education. So if you're a healthcare provider and you have patients that have Medicare or even patients who don't have Medicare just yet, and you would like a place to refer them for high-quality, evidence-based diabetes self-management, please consider referring them to the Oasis program, Better Choices, Better Health Diabetes. And if you'd like to learn more about how to do that, please feel free to contact me after this, and I'd be happy to share more. Thank you.